What if I told you that 99% of people make a fatal mistake in the first 60 seconds of a heart attack that costs them their life? In the next 15 minutes, you'll learn the exact actions that can save your life or your loved one's life during those critical first moments when every second counts. There's one simple action that takes just 10 seconds but increases survival chances by 300%, yet almost nobody knows about it. Gladys from Tennessee felt chest pressure while folding laundry and thought it was just indigestion, so she sat down to rest. By the time her daughter found her 25 minutes later, it was too late. The paramedics said if she had known what to do in those first 60 seconds, she would still be with her family today. Action 1. Call 911 immediately. Don't wait or hesitate. Why do most people waste precious minutes trying to tough it out instead of calling for help? The answer lies in our tendency to minimize symptoms and hope they'll pass on their own. This deadly hesitation is exactly what separates survivors from victims during a heart attack. Research from the American Heart Association shows that every minute of delay reduces survival chances by 10%, making that first phone call the most critical decision you'll ever make. The human brain during a cardiac event often goes into denial mode, convincing us that what we're experiencing couldn't possibly be serious. We tell ourselves it's just heartburn, muscle strain, or stress. Meanwhile, heart muscle tissue dies with each passing second. Emergency room physicians at Johns Hopkins Medical Center report that patients who call 911 within the first 2 minutes of symptom onset have survival rates exceeding 90% compared to just 30% for those who wait longer than 10 minutes. Consider what happened to Franklin from Michigan last spring. He felt crushing chest pain while watching television, but convinced himself it was just gas from dinner. After 12 minutes of hoping it would pass, his wife finally insisted on calling 911. Those 12 minutes of delay resulted in permanent heart damage that could have been prevented with immediate action. The moment you feel chest discomfort, pressure, shortness of breath, or pain radiating to your arm, jaw, or back, pick up that phone and dial 911. Don't call your doctor's office first, don't drive yourself to the hospital, and don't ask someone else to drive you. Paramedics can begin life-saving treatment the moment they arrive, and they have direct communication with the emergency room to prepare for your arrival. Don't wait another second. Your life depends on making that call immediately. Action 2. Chew aspirin, the 30-second lifesaver. Did you know there's a common household item that can prevent a heart attack from becoming fatal? Most people have aspirin in their medicine cabinet, but they don't realize it can be the difference between life and death during a cardiac emergency. Cardiologists at Mayo Clinic confirm that chewing aspirin within the first hour of heart attack symptoms reduces death risk by 25% and significantly decreases the amount of heart muscle damage. The key word here is chewing, not swallowing. When you chew aspirin, it enters your bloodstream through the tissues in your mouth within 5 minutes, compared to 30 minutes when swallowed whole. This rapid absorption allows the aspirin to begin thinning your blood and preventing the blood clot from growing larger. The standard dose is one regular 325 milligram aspirin, which should be chewed thoroughly before swallowing. However, this only applies if you're not allergic to aspirin and you're not already taking blood-thinning medications. Beatrice from Oregon kept aspirin on her kitchen counter after her doctor's recommendation during her last checkup. When she experienced sudden chest pain while preparing breakfast, she immediately chewed an aspirin after calling 911. The emergency room cardiologist later told her that this simple action likely prevented a massive heart attack from becoming fatal, as the aspirin stopped the blood clot from completely blocking her coronary artery. If you don't have aspirin readily available in your home right now, make it a priority to get some today. Keep it in an easily accessible location, like your kitchen counter, bedroom nightstand, or purse. Remember, this 30-second action of chewing aspirin could be what saves your life, but only if you have it within reach when you need it most. Keep aspirin accessible right now. Those 30 seconds of chewing could save your life. Action 3. Sit down and stay calm. Don't panic or lie down. What's the worst position you can be in during a heart attack? Many people instinctively lie down when they feel chest pain, thinking it will help them feel better. This is actually one of the most dangerous mistakes you can make during a cardiac emergency. Emergency medicine specialists at Johns Hopkins report that lying flat reduces blood flow to the heart during an attack and can worsen your symptoms significantly. The optimal position during a heart attack is sitting upright in a comfortable chair with your feet flat on the floor. Lean slightly forward and rest your arms on your knees or a table. This position, known as the tripod position, allows your heart to work more efficiently and helps improve blood circulation. It also makes it easier for you to breathe, which becomes increasingly important as your heart struggles to pump effectively. Panic is another silent killer during heart attacks. When you panic, your heart rate increases dramatically, putting additional strain on an already compromised cardiovascular system. Deep, slow breathing not only helps you stay calm, but also ensures your blood maintains adequate oxygen levels. Count to 4 as you breathe in, hold for 2 seconds, then count to 6 as you breathe out. This controlled breathing pattern activates your body's relaxation response and helps stabilize your heart rhythm. Vernon from Kansas experienced chest pain while working in his garage and immediately sat in his workshop chair, focusing on steady breathing. When paramedics arrived, they found his vital signs more stable than typical heart attack patients, which they attributed to his calm demeanor and proper positioning. The emergency room physician later confirmed that Vernon's actions during those first crucial minutes contributed significantly to his positive outcome. Remember this position right now. Sit upright, lean slightly forward, and control your breathing. Practice this breathing technique today so it becomes automatic if you ever need it. Don't let panic make a bad situation worse when staying calm could be the difference between life and death. Action 4. Loosen tight clothing. Give your heart room to work. Are your clothes making your heart attack worse? This might sound unusual, but restrictive clothing during a cardiac event can significantly impact your survival chances. Studies from Harvard Medical School show that tight clothing around the chest, neck, and waist can restrict blood circulation when your cardiovascular system is already under extreme stress. Every bit of improved circulation matters when your heart is fighting for your life. Tight belts, collars, ties, bras, and waistbands create additional pressure on blood vessels that are already struggling to deliver oxygen-rich blood to your vital organs. During a heart attack, your body desperately needs maximum blood flow to compensate for the reduced pumping efficiency of your heart. Even seemingly minor restrictions can compound the problem and worsen your condition. The first step after calling 911 and taking aspirin is to immediately loosen anything tight around your chest, neck, and waist. Unbutton your collar, loosen your belt by several notches, remove your tie if you're wearing one, and if possible, loosen restrictive undergarments. This simple action takes less than 30 seconds, but can improve your circulation significantly during those critical first minutes. Dolores from Florida was wearing a tight-fitting dress when she experienced chest pain at her granddaughter's wedding. Her quick thinking to loosen the dress around her chest and waist helped her breathe easier and feel more comfortable until paramedics arrived. The attending physician noted that her relatively stable condition upon hospital arrival was partly due to the immediate steps she took to improve her circulation. Check your clothing right now. Make sure nothing you regularly wear would restrict your circulation in an emergency. Consider keeping your belts a bit looser than usual, especially if you have risk factors for heart disease. This simple adjustment could make a crucial difference when every breath and heartbeat counts. Action 5. Stay on the phone with 911. Don't hang up. Why do people hang up on the very person trying to save their life? Many people call 911, give their address, and then hang up thinking their job is done. This is a potentially fatal mistake that eliminates a crucial lifeline during your most vulnerable moments. Emergency medical services data shows that staying on the line with the dispatcher increases survival rates by 40% because trained professionals can guide you through life-saving techniques until paramedics arrive. 911 dispatchers are trained in emergency medical protocols and can provide real-time instructions that could save your life. They can guide you through proper positioning, breathing techniques, and what to do if your condition worsens. If you lose consciousness, they'll know immediately and can dispatch additional resources or provide instructions to anyone else who might be with you. These dispatchers are also in direct communication with the ambulance crew heading to your location. They relay important information about your condition, symptoms, and any changes that occur during the call. This allows paramedics to prepare the appropriate equipment and medications before they even arrive at your door, potentially saving precious minutes of treatment time. Eleanor from Nevada stayed on the phone with dispatch during her heart attack, and the operator guided her through controlled breathing exercises that helped stabilize her heart rhythm. When paramedics arrived, they were already informed about her medication allergies and current symptoms, allowing them to begin the most appropriate treatment immediately instead of spending time gathering information. Keep that phone pressed to your ear and follow every instruction the dispatcher gives you. Don't worry about tying up the phone line. This is exactly what 911 is for, and your call is their top priority. That phone connection is your lifeline to professional medical guidance when you need it most. That phone line is your lifeline. Never let it go during a heart attack. Action 6. Unlock your door. Make sure help can reach you. What good is calling 911 if paramedics can't get inside to help you? This is one of the most overlooked aspects of heart attack response, yet it can mean the difference between receiving immediate treatment and dangerous delays. Fire departments across America report that locked doors delay life-saving treatment by an average of 8 minutes, while emergency responders work to gain entry to homes and apartments. Those 8 minutes might not sound like much, but during a heart attack, they represent potentially irreversible heart muscle damage. Paramedics carry life-saving equipment and medications that can stabilize your condition and minimize permanent damage to your heart. However, all of this advanced medical care becomes useless if they can't reach you quickly because doors are locked and deadbolted. After calling 911 and chewing aspirin, your next priority should be unlocking your front door. If you live in an apartment building, also unlock or prop open any lobby doors if possible. If you're too weak to get to the door yourself, ask someone else to do it immediately. Don't worry about security for those few minutes. Your life is more important than any material possessions, and paramedics will secure your home once they're inside. Harold from Colorado unlocked his front door immediately after calling 911 during his heart attack. When paramedics arrived 6 minutes later, they were able to begin advanced cardiac life support within seconds of entering his home. The emergency room cardiologist later explained that this immediate access allowed them to administer crucial medications that prevented Harold's mild heart attack from becoming a massive one. Right now, take a moment to think about your door locks and how quickly you could unlock them in an emergency. If you have multiple deadbolts or complex locking systems, consider simplifying them or keeping keys readily accessible. Practice unlocking your door quickly so you can do it even if you're feeling weak or disoriented. Unlock that door right after calling 911. Don't let a lock cost you your life. Action 7. Alert someone nearby. Don't suffer in silence. Why do people hide their heart attacks instead of getting help from people around them? Pride, embarrassment, or fear of being a burden often prevent heart attack victims from alerting family members, neighbors, or anyone else who might be nearby. This tendency to suffer in silence can be deadly. Research from the CDC shows that having someone present during a heart attack doubles survival chances because that person can provide assistance if you lose consciousness and can perform CPR if needed. If you're at home, immediately call out to family members, even if they're in other rooms or sleeping. If you're in public, don't hesitate to ask strangers for help. Most people want to assist during medical emergencies and may have valuable skills or knowledge. If you're alone at home, consider calling a neighbor, close friend, or family member who lives nearby and can reach you quickly. The person who responds can help in multiple ways beyond just providing emotional support. They can unlock doors for paramedics, gather your medications to show emergency responders, provide information about your medical history if you become unable to communicate, and most importantly, they can perform CPR if your heart stops before professional help arrives. Every year, thousands of lives are saved by ordinary people who learned basic CPR techniques. Whenever possible, that person should also be prepared to guide paramedics to your exact location, especially in large apartment buildings, rural areas, or anywhere the address might be confusing. They can watch for the ambulance and signal the crew, potentially saving additional precious minutes. In apartment complexes or gated communities, having someone available to provide access codes or unlock gates can significantly speed up emergency response times. Judith from Washington called her next-door neighbor immediately after calling 911 during her heart attack. Her neighbor, who had taken a CPR class years earlier, stayed with Judith and was able to perform chest compressions when Judith briefly lost consciousness. The paramedics credited the neighbor's quick actions with keeping Judith alive until they could take over her care. Don't face this emergency alone. Get someone to your side immediately after calling 911. Swallow your pride and ask for help because your life is more important than any embarrassment you might feel. Having another person present could literally be the difference between life and death. Don't face this alone. Get someone to your side immediately. These 7 actions can transform a potentially fatal heart attack into a survivable event that you can recover from completely. Remember the sequence. Call 911 immediately. Chew aspirin. Sit upright with controlled breathing. Loosen restrictive clothing. Stay on the phone with dispatch. Unlock your door and alert someone nearby. You now have the knowledge that 99% of people lack. Knowledge that could save your life or the life of someone you love. Each of these steps takes less than a minute to complete, but together they create a comprehensive response plan that maximizes your chances of survival and minimizes permanent heart damage. Have you ever experienced chest pain that worried you? Or do you know someone who survived a heart attack? Share your story in the comments below because your experience could help save someone else's life. If this video could help your friends and family survive a heart attack, please share it with them right now. You might be giving them the gift of life itself. Like this video if you learned something that could make a difference. And make sure you're subscribed for more life-saving health information that every person over 60 needs to know.